I'm Dr. Rajdeep More, consultant gastroenterologist, hepatologist and GI interventional endoscopist at Gastrocure Endoscopy Center in Liver Care Clinic in Thane. Let us talk a bit about gallstones. So what are gallstones? So normally the bile which is required for digestion of food is secreted in the liver. It is prepared in the liver. From the liver it enters the gallbladder and is stored overnight. When a person eats food and it reaches the intestine, that is when the bile from the gallbladder enters the intestine and helps in digestion of the food. So many conditions lead to slowness of the movement of the gallbladder or lack of movement of the gallbladder, which prevents pushing of the bile down into the intestine. When this bile gets stagnant and gets saturated in the gallbladder, it results in formation of what we know as gallstones. So these gallstones can over a period of time cause damage to the gallbladder wall and eventually lead to what is called as cholecystitis or acute cholecystitis. In other conditions, the gallbladder stones may also slip from the gallbladder down into the bile duct and cause narrowing or prevent the flow of bile and lead to cholangitis or jaundice, yellowish discoloration of eyes and urine. So what are the risk factors, symptoms and complications of gallstones? Regarding risk factors, female sex of age of more than 40 years, obesity, these are more prone to develop gallstones. The other risk factors include high cholesterol, high fat diet, underlying diseases such as diabetes, sickle cell disease, liver diseases, history of unsupervised use of antibiotics such as ceftriaxone or oral contraceptive pills, history of significant weight loss in a short time either through bariatric surgery or voluntarily. All these are risk factors for gallstone disease. Also, if you have a family history of gallstones, there is a risk factor for you to develop gallstones. So gallbladder stones can be asymptomatic or symptomatic. So symptoms can be in the form of severe right upper abdominal pain with fever and vomitings. The complications of gallbladder stone, when do you suspect that, when do you visit a doctor, or when do you actually go in for intervention? So when you have severe abdominal pain complicated with presence of either jaundice, which would suggest that there is a bile duct block. If there is significant abdominal pain, it could suggest a gallbladder perforation, and rarely, in very few cases, there can be a possibility of gallbladder cancer with long-standing symptomatic large gallbladder stones, but that risk is very rare. So how do you treat or how do you prevent formation of gallstones? Maintaining a healthy lifestyle, low-fat diet, a diet which is rich in fiber, daily exercise. These are some of the measures that you can take to prevent formation of gallstones. Now, should all gallstones undergo treatment? Are all gallstones harmful? The answer is no. If the gallstones are present without damage to the gallbladder, without any cholecystitis and without symptoms, they can be routinely followed up with a screening ultrasound and do not require intervention immediately. However, if you are having pain, persistent pain and imaging findings or ultrasound suggestive of acute cholecystitis, that is inflamed gallbladder, then it has to be operated surgically. If the gallbladder stones slip down from the gallbladder into the bile duct, then we have to remove those bile duct stones with an endoscopic procedure called as ERCP or endoscopic retrograde cholangiopancreatography. So if you have been diagnosed with gallstones either on routine screening or on ultrasound of the abdomen, there is no need to panic. Please visit your doctor or gastroenterologist to understand further regarding how they should be managed.